This talk is going to discuss utilizing athletic training evaluation and intervention techniques to improve firefighter motion. Our researchers were Jennifer Volberding, Eric Warren, and Steve Lantern, all a part of the athletic training program here at the Center for Health Sciences. The profession of firefighting is an inherently high-risk and potentially life-threatening profession. Firefighters are required to maintain a full active duty status while battling chronic conditions related to the risks and continuous preparation for the job. These risks may include, but are not limited to, low back pain, cardiovascular difficulties, and other aches and pains, making it difficult to perform their duty. Often, these chronic aches and pains may be directly related to decreased range of motion. Thus, the purpose of this study was to determine how often firefighters suffer chronic pain and the impact of a 12-week intervention strategy to improve range of motion. We had 24 firefighters from a single suburban fire department participate. They had an average body mass of 94.1 kilograms, 63.9 centimeter heights, and average 13.2 years of service. A health history was conducted to determine if the participants complained of chronic pain that did not require them to miss work, and how often that pain occurred. Subjects then performed a basic health fitness assessment that included a comprehensive range of motion assessment that included 13 measurements on each limb. These measurements included hip flexion, extension, internal rotation, abduction, adduction, and knee flexion, ankle dorsiflexion and plantar flexion, and shoulder extension, flexion, internal rotation, and external rotation. Again, each of these was done on both the left and right side. After the completion of the initial intake, subjects were asked to complete a 12-week semi-individualized intervention program that consisted of functional training, strength training, and typically a running-based program based upon the movement deficiencies identified in the initial assessments, as well as a comprehensive stretching protocol. As part of the project, all participants received a stretch band, instruction, and a poster to take home to include range of motion activities every day. So what did we find? We found that 13 of the 24 participants stated that they suffer from chronic pain that did not require them to miss work. They averaged 4.69 plus or minus 2 days of work a week where they suffered from this chronic pain. Additionally, we found that 7 of the 26 range of motion assessments demonstrated a statistically significant change before and after the 12-week program. The 4 motions that improved were right hip flexion, right hip internal rotation, left hip flexion, and left hip internal rotation. Unfortunately, over the 12-week program, we also saw 3 motions decrease in their movement. And those motions were right hip external rotation, left hip external rotation, and left ankle plantar flexion. We're not really sure as to why we saw those decreases with the overall improvement. However, it may just be a small sample size. So what does this really mean? We know that generalized whole body stretching techniques have been demonstrated in the literature to improve range of motion. This study demonstrated improvement in hip range of motions. Improvements in hip range of motion can decrease the risk of low back injuries, which are prevalent in the firefighting population. Future studies should implement more subject-specific stretching strategies to focus on individual deficits rather than the semi-structured intervention techniques utilized in this study. Firefighters and other tactical populations may want to implement range of motion strategies to movement and function related problems that are caused by the high demands of the job as part of their overall departmental fitness training.